Those who are there will again put, madam. Please continue.
Okay.
Sorry for the technical glitch.
Okay. Okay, Dr. Divakar.
Yeah.
So I think you can take up the medical and non-medical management strategies of atopic dermatitis, right?
Atopic dermatitis is a chronic condition. That's why it's very important to have a discussion with the parents and explaining the natural course of the disease. So there should be made clear at the outset that this is a chronic relapsing remitting course and it will continue for months or years. Then they should be told about the avoidance of dry skin and use of the emollient. If you look at the medical management, emollient and topical steroid are the mainstay of the treatment. Parents should be taught that the 5 to 10 minutes warm bathing and should be followed by liberal application of the moisturizer and to seal the moisture content. So we should not dry the skin after bathing. In mild cases, the application of emollient is good enough and that it can take care of the illness. However, in moderate cases where emollient is not sufficient, we can use mild potency or moderate potency a local steroid. And if it's not responding, then there are several other medications. At this point of time, if I'm severe or uncontrolled atopic dermatitis, usually refer back to my dermatologist friend, where they can consider immunosuppressive therapy or biologicals. But mild to moderate can be treated with a pediatrician with the emollient and topical steroid.
So,
and one more thing, if there is infection, it should be taken care of with antibiotic. Simplex
Yeah.
or yes,
okay, so now the house is open to discussion.
वोमिटिंग जैसा हो रहा है उसको फील हो रहा है तो क्या करा सुबह से भाई
Hello.
वो पतले दस्त है क्या पतले दस्त तो नहीं
Dr. Avinash, please mute yourself.
Dr. Sharma, please mute all the participants.
Yes, all are muted, and those who want to discuss, please unmute yourself.
Hello.
Yes, sir. Yes, ma'am.
So now the house is open to any discussions. Now,
Yeah, some questions are there, Dr. Geeta Bansalji.
Yes.
Acne related with lack of sleep and fried food. Any relation? Maybe the panelists or even Smita Murli, anybody can answer.
And Dr. Abhik, would you like to answer that? Acne related with lack of sleep and fried food. And Dr. Shilpa is also there. Both of you can take up that.
Is it related?
Hello.
Hello, Dr. Abhik, are you there?
Yes,
yes, ma'am. So lack of sleep basically adds as a stressor factor. So any kind of stress, be it physical or mental, would aggravate, acne flares. And regarding diet, yes, the more you have of, fried fatty food, diet which is high in high glycemic index, processed foods, that would lead to an exacerbation of your acne lesions, especially in cases of hormonal acne, because sleep and diet would lead to difficulty in management of your polycystic ovarian disease as well. So if that is the underlying reason for acne, you would get flares intermittently.
And does excess exposure to sun increase dermatitis?
Yes, there are certain photosensitive dermatitis, photosensitive dermatoses that we get. So depending on the diagnosis, sunlight would play an aggravating role, but only in case of photosensitive dermatoses.
Okay. And so now we have one more question in the chat box. That is role of oral steroids in severe dermatitis.
Yes, there is a definite role, but only for a short course. So which can be used to control the acute phase. So probably a duration of 5 to 7 days should suffice.
Okay. So are there any more questions from the house?
Any relation to egg intake, number of egg yolks you can have in one day with acne, any relation with acne?
Ma'am, I didn't get your question.
Egg intake,
Egg.
egg yolk.
Egg yolk.
No. There is no literature to support or refute that correlation.
What about dermatitis relation to excess exposure to sun or oral steroids? Role of oral steroids.
Yeah, he has already answered that.
Yes, ma'am. So there are certain photosensitive dermatosis. So in that case, in such in conditions, sunlight would play an aggravating role.
There was another question in the chat box that Dr. Chaya's question that how to apply benzoyl peroxide in retinoids.
P size amounts only to the affected area. So again, retinoids is there are different grades and classification of retinoids, whether it's a first generation, second generation, or third generation. First generation retinoids are notorious for causing local irritation, burning sensation, erythema, and dryness scaling. So if you're using a first generation retinoid, you need to be very careful. You need to start slow, probably see if the patient can tolerate that given amount for a sufficient duration. If the patient can tolerate that, only then you would probably want to increase the frequency. And it should be applied on a dry skin because since it's fat soluble, it would help in better absorption. P size amounts only to the affected area.
There is another question regarding the same. How frequently they should be applied?
Once daily at night.
Okay. Both benzoyl also and retinoids also.
Yes.
So there is one very interesting question, and you will have to answer that one. Premature graying of hair. So tell us something about that.
Problem for everybody.
So for this, we need to identify what classifies it mature. So we even have 10-year-olds coming in with premature graying. We have 30-year-olds coming in premature graying. So again, it depends on what is physiological and what is psychological. So more often than not, a patient with a single gray strand would come in, and we should not make a diagnosis of premature graying in such cases. But if there is a substantial portion of your scalp turning white, that would be an ominous sign. So we need to look for any underlying triggers or underlying conditions which might lead to such changes. So there can be some nutritional deficiencies, some systemic conditions. Then we can give supplements or treat the underlying condition. But even then, with prolonged therapy, it's only 50% of patients who actually respond. So proper counseling should be done right at the initiation of therapy. Try to set the treatment goals for such patients because the outcome may not be satisfactory to the patient at the end. So, yes.
Dr. Smita, would you like to add something?
Ma'am, one thing I want to add is in premature graying, always examine the scalp, rule out vitiligo of scalp.
Okay.
That is one common missing we find there. There are some cases in which premature graying is due to vitiligo, and the hair loses colors because of that vitiligo patch there. Then again, anything means as per definition, less than 30 is taken as premature graying, less than 30 years. And the treatment again, as Dr. Abik told, it's only 50-50. We give calcium pantothenic tablets, and some solutions are also available. Grey egg solution, etc., are available in markets. We can try it. Again, it's 50-50. Some improve, some just it's like less useful. Okay, ma'am.
Thank you so much, ma'am. And with that, we would like to round off the session. And are there any more questions? Because I couldn't see any more.
No. Ma'am, Dr. Sudhir Mishra here. Can I ask a question?
Yes, yeah, sure, sir.
Ma'am Smita Murli has said that sunscreen should be used by everybody and people should avoid moving out in sun between 9 a.m. to 3 p.m.
Yeah. Even I was
Now
wondering about that.
we as pediatricians know that that is the time when body makes maximum vitamin D.
Yeah.
And lack of sun exposure, which sunscreens will cause, will ultimately put the person to vitamin D deficiency state. So what is the balance and what should we be doing?
Thing is, sir, the right now the because of this UV radiation more in these working hours, you can prefer like early morning, like 8 to, that is
Ma'am,
okay. And you also give vitamin D supplements also nowadays, because the sunburn,
that's-
everything is so common nowadays. So I will always prefer, because the
so
number of
ma'am, the I think the balance comes where if you have problem with sun exposure and your skin is causing problem, then you use sunscreen rather than advising it for everybody. Because
but still
using vitamin D supplement is a non-natural way of keeping your vitamin D levels
taken,
I mean
sir. But
normal.
The first thing to decide is whether the application of a sunscreen leads to, non-absorption of vitamin D.
no, like it's
No.
only on the face that we apply, and sir, sir.
No,
Yes, please.
madam, the question was that uh, does the application of sunscreen lead to deficiency of vitamin D? Means will it obstruct
No, ma'am. Like
the
no
formation of
studies that
vitamin D?
there is no significant study showing that.
Yes, that's
There
what.
is no
Yes,
not much study showing that, ma'am.
yes. That's what I
Yes, of
wanted to
course.
come at. Point. It doesn't obstruct, vitamin D synthesis in the skin by the sun, even if you go out after applying a sunscreen. That is the main thing.
So
Okay.
after 3 p.m., there is no need to apply sunscreen. After 3 p.m., there is no need to apply sunscreen.
Dr. Smita, ma'am?
All it's a theoretical this thing, ma'am. But the maximum UV exposure happens there, and the sunburn is more on that area and that time frame that it has been studies have come out. But this question I haven't thought about earlier, ma'am. Anyway, usually we apply sunscreens as a part of our routine skincare, and I think after 3 also, I'll have to find out, ma'am. I can't give a satisfactory answer for that.
Okay. It's
Madam,
okay.
is SPF 50 more effective than SPF 30?
Ma'am, that thing is, after SPF 30, even if the SPF is increasing, it's only like some percentage increase. Like if SPF 30 plus is there, you get 97%. And after that, it's like 97, 98, 99. So not much of a difference. So
Okay, so
SPF 30 should work fine, ma'am.
okay. Thank you.
See,
So
ma'am, you were saying about the acne, you apply the benzoyl peroxide as well as retinoid in the night. But how will you apply both the things at the same
Yeah.
time?
Ma'am, combinations are available, ma'am.
Okay.
Both combination creams are available,
Okay.
and you have
Okay.
to just like apply. These are available, and single therapy is also there.
Okay. Okay.
So thank you. Actually, I'm just seeing my daughter texting. She's there away in Bangalore. She joined Neha Singh. She's also doing dermatology second year. So she was interested and I just shared the link. She asked about the investigations, I think, regarding the significant graying of hair. I think it was answered.
Yeah, systemic investigations to be done in case of significant graying of hair. What investigations are to be done?
Yeah, can anybody answer? Maybe Smita or a dermatologist friend.
Mute. No, not severe. Like
Dr. Smita?
Is it like systemic investigation to be done in premature graying?
What investigations to be done in significant graying of hair? Anything you want to evaluate for?
Systemic, ma'am, main thing that calcium pantothenate deficiency is the most commonly known thing, and the other means common things what we look for is like a clinical examination only, ma'am. We don't do much of a systemic examination there.
Investigations.
Investigations. Like no,
anything to know the hormonal imbalance or anything like that?
No, ma'am. No, ma'am. It's not due to hormonal imbalance. No, ma'am.
I think we should close now, Shamik. It's
Yes,
now.
yes, ma'am.
Thank you. And from my side to the youth people who are not, I think they couldn't come back again. Some of them we lost when we had a technical glitch, but we're sure we're going to share the recording throughout the whole session. It a very useful session. I think most of us enjoyed it because related not only for skin, it was a little bit of cosmetology also. So the huge attendance, I think half of them was the cosmetic effect. Thank you, Smita and the whole team, and of course Geeta and all. From my side, over to Shami for the formal vote of thanks. Or maybe to Sharma,
ma'am.
Apne Sneha madam.
Dr.
Yeah,
Sneha has got a sore throat today.
Sorry, madam, बहुत तकलीफ हो रही है. My throat is paining too much.
Ma'am, say thank you.
Sir, please.
Okay.
But wonderful session. Sir, please, you
Okay,
give
thank
vote of thanks.
So, can I request Dr. Arun Sharma to give the vote of thanks, please?
Continue, Samik sir. You please continue.
Thank you to all the huge round of thanks to the panelists and to Dr. Geeta Bansal for having compiled such a beautiful and interactive session. And I think so most of us have benefited today by practical aspects of treatment. And we are all very, very grateful. The group which has been formed, we'll keep it going for some more time so that, we can have a few more sessions or discussions, maybe at our national conference or at other zonal conferences, because this is something which the adolescent medicine demands, because investing in the skin is probably one of the most fruitful and rewarding investments for an adolescent. Thank you to everyone. Good night and